Well, January is Cervical Cancer Awareness Month, and while cervical cancer is one of the most preventable cancers, many people still don't know enough about how to protect themselves. Joining us today is Dr. Malcolm Ross, an oncologist with Novant Health. Doctor, appreciate your time. We know you're really busy here in between surgeries and administration stuff. Let's start from the beginning here. Why is this highly preventable?
Sure, yeah, I think that's a great question, and a lot of that drives to the link to the HPV virus. 99% of cervical cancer is actually caused by HPV, and HPV, just like any other virus, can usually be cleared by the immune system, but in certain situations it doesn't. And in those situations, we usually see about a lag time of 10 to 15 years before it causes real problems beyond pre-cancer. And so this brings up two unique opportunities to prevent and to treat this problem. And the first focus is really on vaccination, which is our prevention. And then, as I mentioned, that lag time that's about 10 to 15 years brings up a great opportunity for a secondary heavy focus on screening and intervening before we progress to severe precancer or cancer itself.
All right, let's talk about the HPV vaccine. Who should get it, and how effective is it in preventing cervical cancer?
Sure. Obviously another great question. So vaccination is the most effective way to ensure protection against cervical cancer. It's one of the biggest wins in modern medicine. Currently, the vaccine in the United States covers 9 of the highest risk strains, and it can prevent greater than 90% of cervical cancer caused by HPV. I think it's also important to point out that this vaccine prevents vulvar, vaginal, anal, or oral head and neck cancers as well. The current recommendation is for male females age 11 to 12, but it can be given as young as age 9 and up to age 45. The real goal is to complete the vaccination series before the initiation of sexual activity. When we look at the older age group, people over age 26, it's really going to be a discussion between the person, the patient, and the healthcare provider as to whether that is appropriate.
Yeah, I would imagine that is a personal decision for families. How about women? How often should they get screened for cervical cancer, and what does that process involve?
Sure. So I will point out that currently there's more than 25% of women that are not up to date in their screening. It's important to also note that there's more than 8 different societies that give recommendations, but there's a lot of overlap, and screening should really start at age 21. For age 21 to 30, we usually just recommend a pap smear. One society does recommend HPV testing only. Once we get into ages above 30, it's a combination of a pap smear plus HPV or HPV and pap smear alone. And also want to point out that these guidelines should always be very individualized to the patient, discussion with the healthcare provider, what symptoms somebody might be having, their own underlying medical issues, compromised immune systems, or prior histories of abnormal pap smears or procedures done on the cervix.
All right, what are some of the early warning signs then of cervical cancer that women should watch out for? And then if you do find out early enough, what's the treatment process following?
Okay, so usually what we tend to see are symptoms that may not be completely out of the norm, but when you take them all together in constellation and you're seeing your healthcare provider, they can put together the puzzle and help make the diagnosis soon. So that would be changes in your bleeding pattern. That might be heavier cycles, bleeding in between cycles, bleeding with exercise or intercourse, and this is usually combined with pelvic pain or discomfort. That could be worsening back pain, again in combination with the bleeding. In a more advanced situation, you may see bleeding also with blood in the urine or in the stool. Again, a lot of these things may not be cervical cancer, so it's not that you should just jump to immediately thinking that you have cervical cancer, but they are warning signs, and you should seek regular care with the provider and let them know if something feels like it's changing related to these things.
Are certain women at higher risk than others for cervical cancer?
Sure. Pointing this out, I do want to say that this is the 3rd most common female cancer in the U.S., and it's actually the 3rd most common cause of death, with about 16,000 cases a year and 4,000 deaths a year. The people that are most at risk would be people that didn't receive the full vaccine series or the vaccine at all, people that may not have access or utilize regular screening or healthcare visits with their providers. Sort of touched on this a little bit earlier, but people with a weakened immune system, that could be from something like HIV or AIDS, steroids, or somebody that has a transplanted organ that might be on an intentional medication to suppress their immune system. As you pointed out earlier, this is largely driven by HPV, which is a virus, so a lot of this process is mediated by our immune system. In line with that, smoking also weakens the immune system. Other risk factors that we see are people with multiple sex partners or higher risk sex partners having other HPV-mediated diseases, so this could be like genital warts, anal, vaginal, or vulvar, precancer, or cancer.
All right, so as we wrap things up here, Doctor, what is your message then to viewers from our conversation today?
I would say watching out for the signs and symptoms we discussed, seeking regular health care, talking to your providers, asking them if you have questions, concerns, and really an emphasis on vaccination for prevention and screening and staying on top of those things.
All right, Dr. Malcolm Ross from Novant Health, appreciate the time. Great information today.
Yeah, thank you for having us on. Appreciate it.
Of course.